The pathogen and the susceptibility to give an infectious agent will be influenced by genetics, immune function, and the individual general health status at the point of work. Direct contact requires skin-to-skin contact between affected person and host who is supplemental to infectious agent. Indirect contact occurs when the supplemental host contacts an object that has been purposely handled by the affected person. Airborne infections are spread through the movement of the dust or from ventilation symptoms. Droplet infections occur from coughing and sneezing. The supplemental host may inhale infectious agents that are in the environment. Standard precautions are standardized protocols that identify safe practices in the prevention of infection by pathogens that exist in the blood and body fluids. These guidelines apply to all the pathogens. OSHA is an agency that was developed under the Occupational Safety and Health Act in 1970 under President Nixon's administration. OSHA works to ensure the health and safety of American workers through regulations, laws, and enforcement. Personal protective equipment. The purpose of personal protection equipment is to decrease the incidence of infection in healthcare workers. The equipment should be appropriate to situation and degree of contamination. In addition, the equipment should be used consistently and correctly. Gowns cover the entire body and have long sleeves that fit snugly around the wrist. Clean gowns may be used for patients in isolation, while sterile gowns are required for all invasive procedures. If contamination with fluids is anticipated, a fluid repellent material should be chosen. Gloves protect the hands and should be changed behind individual tasks and if damaged to prevent cross-contamination from one area to another. Hand washing is also necessary for gloves are removed. Once gloves have been contaminated, they must be removed and discarded. Masks must fit firmly over the bridge of the nose and the mouth. If contamination of other areas of the face is possible, as when irrigating wounds, a face shield that covers the entire face to the forehead is indicated. Specialized particulate masks must be used for airborne organisms such as tuberculosis. Caps should fit snugly, covering the hair in order to protect the healthcare worker from contamination and to protect the patient during invasive procedures. Eye protection from droplet infection and splashing of secretion can depend on personal eyelashes or eye lenses. Depending on the anticipated contamination, and field shield may be chosen in the place of standard safety glasses and masks. Hand hygiene is essential to maintaining medical asepsis. These are two acceptable methods: hand washing and the use of alcohol-based rubs. All providers must wash their hands. Let me put this up. All providers must wash their hands before and after patient contact. When handling any of the objects that enter the patient's environment when leaving the patient's care. Alcohol-based hands rubs are able to kill germs more effectively than soap and water, and according to some authorities, may be less irritating to the skin. However, soap and water are still the most effective when it comes to removing germs from the skin, though not necessarily killing them. The post-exposure plan is a set written guideline that must be followed when a healthcare worker is exposed to the infectious pathogen as the result of sharp injury, patient behavior, and failure of the patient's protective equipment. The exact step of the plan will be appropriate to a specific infectious agent. All exposures will be followed by medical examination, serial laboratory tests to monitor for the presence of infection. Vaccinations aimed at limiting the incidence of disease may be appropriate in some circumstances. Individual and institutions are responsible for educating all employees about the post-exposure plan, as well as monitoring the implementation of plan following any indicate that involves exposure of employee to infectious agent. Healthcare facilities must have an IWAS station that meets occupational safety and health administration standards. After an exposure, the station should be activated via a clearly marked lever. The eyelids should be held open for water to flow inside the eye for a period of 15 minutes. The affected person should roll them around to ensure that the water rinses all surfaces. Contacted lens, if worn, should be removed during the process. Sharps include hypodermic needles, surgical scalpels, lacings, and all of the devices that can puncture the inact. The devices may be destroyed by heat, oxidation of the stainless steel needles, or by passing an electrical current through the needles. Metal asbestos is considered a clean technique that is aimed at reducing the number of infectious agents in patients' environment. Sanitation is the process of cleaning utensils and environment with soap and water and attain general cleanness. Disinfection refers to the use of more potent cleaning agents to destroy infectious organisms which exist on inanimate object that exists in the patient care environment. The CMA understands that sanitation of the reception room must be priority aesthetic purposes as well as infection control purpose. All surfaces and furnishing must be cleaned with approved cleaning agents per agency protocol. In addition to regularly scheduled maintenance, the providers ensure that there are resources in place to respond immediately to any incident that may occur in the reception area. Biohazard waste is identified as any material that has been contaminated by body fluids or blood, which can potentially harm individuals or environment. Disposable methods include the use of the incinerator, autoclave, microwave, in addition to chemical disinfection or irradiation. The disposal of biohazard waste is generally regulated by Department of Health in the individual state, which means that healthcare workers must be aware of applicable state laws. Blood and blood-filled fluids are designated as biohazards and medically regulated waste. At the bedside, these wastes are placed in appropriate collection bags, which are identified as hazardous waste and subsequently destroyed by irritation. A spill kit contains all the equipment and information that is necessary to safe clean and after accidental spill or leakage of the fire hazard material. In a healthcare environment, it is imperative that appropriate signs be hung in areas when any potential hazards and dangers may lie to keep people safe. Knowing what common safety signs, symbols, and labels look like will help the CMA safety navigate through their environment. Commonly seen signs including the following categories. Wet floor signs. The signs will be placed by housekeeping it, most commonly after mopping a floor for worn or slipping hazard. No smoking sign. Most healthcare facilities are smoke-free areas, so the smoke sign will be something in the CMA will be familiar with. Caution. A caution sign warns of potential hazard. The hazard may pose a risk of minor to moderate injury to the healthcare worker. Caution signs are usually yellow and black. Warning. Between caution and danger signs are warning signs indicating the potential for serious injury or even death. The signs are usually formatted as black letters or on an orange background. Biological hazard. This type of hazard originates in a living thing such as bacteria, viruses, or insects. Danger. This type of safety sign indicates an immediate hazard that can cause death or serious injury. Safety data sheets. Safety data sheets contain detailed information for all substances that are designated biohazardous, including the important use of personal protective equipment, first aid protocol, disposable requirements. Institutions are required to publish an SDS for any substance that is corrosive and may cause cancer, damage to an unborn fetus, or damage to the ovaries, testes. Workplace safety, emergency preparedness advocation. All healthcare agencies will create a plan that identifies the personal action resources required to respond to any emergency. The provider will participate in implementation of the plan as necessary. The provider will assist agency employees to implement the evacuation plan for all patients and staff. The provider will verify that all supplies recommended for emergency resuscitation according to advised cardiac life occurs protocols. ACLs are available for use. The content of the crash must be specific to the patient population. Adult care unit supplies will differ from pediatric care unit supplies. In addition, the provider will verify that all sterile supplies have valid sterility dates. Fire prevention regulations extinguisher. All healthcare workers, include CMAs, must have a basic amount of training in fire safety and prevention. The basic concept of fire safety includes fire hazard, cigarette of any other type of smoking is serious fire hazard. Most healthcare facilities are smoke-free, but some have designated areas where smoking is allowed. Patient on supplemental oxygen should not be allowed to smoke, and oxygen is highly faulty and improperly used. Equipment cut pose a fire hazard. The CMA should keep a lookout for frayed wires, split cords, or overloaded extensions. The CMA should know the facility's procedure for responding to a fire, including the emergency plan, location of the fire alarm, fire extinguishers, and emergency oxygen shut-off valves, and how to move the patients and staff to safety use of emergency exit. Rescue, the acronym RACE refers to the following to be taken when responding to a fire in a healthcare facility. R, rescue anyone directly threatened by the fire, patient being priority, place them in a nearby room behind the closed door. A, activate the emergency response system when the fire is discovered, usually by pulling the emergency fire alarm. C, confine the fire by closing all facility doors. E, extinguish the fire only if it's small enough for extinguisher to handle, otherwise let the fire department handle fire extinguisher use. Every healthcare employee needs to know how to operate a fire extinguisher using a pass. Pass, pull the pin. A, aim the pass of the fire. S, squeeze the trigger. S, sweep it to the side. Emergency management, identification, response, basic first aid. The provider will use basic first aid to respond to the following emergencies and will access emergency care as appropriate. Emergency basic first response. Abrasion, clean the wound and make sure patient has tended shots. Avlution, reset limb through splitting or casting. Bleeding or pressure points, apply firm pressure to the site and clean cloth. Burns, rinse with cold water, apply aloe, cover with clean dressing. Cataract or responsive arrest, CPR. Depending on the training, advocate emergency medical services. Chemical exposure, gather information, wash area, induce vomiting unless casket. Foreign body obstruction, Heimlich maneuver, back blows and abdominal thrust. Choking, Heimlich maneuver, back blows and abdominal thrust. Diabetes, ketoacidosis, recognize manifestation, activate EMS. Insulin shock, recognize manifestation, offer candy if alert, activate EMS. Bone fracture, treat bleed, embolize the limb, apply ice. Poisoning, position on left side and identify substance, call 1-800-222-12222. Seizures, position on side, protect the head. Shock, elevate the feet, maintain body warm, CPR as necessary. Shock, elevate the feet, maintain body warmth, CPR is necessary. Cerebrovascular accident, CVA, recognize manifestation, activate EMS. Scenic scope, elevate legs 12 inches, loosen restrictive clothes. Vertical, maintain safety, access care to treat the cause. Wounds, control bleeding, cover with clean material, access emergency care. Punctures, tentative shots, sterile bandaging and topical and oral antibiotics. Cold exposure, remove wet clothes, blankets, and gradual warming fluids if alert. Heat exposure, activate EMS. Cold heat exposure, activate EMS and cold packs to post points. Cold environment, joint dislocations, immobilize the limb, activate ice, access ER care for dislocation. Asthmatic attack, rescue meds, activate EMS if an improvement. Hyperventilation, calm victim, use paper bag, activate EMS with CO, chest pain, animal bite, control bleeding, clean site, apply antibiotic ointment and cover. Insect bite, remove stinger, access for anaphylaxis, clean site and cover. Concussion, activate EMS, access breathing and level conscious. Laceration, clean the wound and cover with sterile band-aid stitch if required.